Very good morning, students. This is a short note about the movements of the temporomandibular joint. In the last video where I taught you about the temporomandibular joint, I said that the muscles which are producing the movement of the lower jaw at the temporomandibular joint, they are many and the movements are also many and complicated. So I'm just recording this separate video for the movements of the temporomandibular joint. The question is, write a short note on the movements of temporomandibular joint. In answer, you may directly come to the movements. That is, the following movements occur at the lower jaw. Okay, as you know that only the lower jaw is the bone which is mobile in the whole of the skull. Okay, so all the movements they are taking place is at the lower jaw. Okay, now the first movement which we will learn is the protraction or the protrusion or the forward movement of the jaw. When we move the jaw forward in anterior direction towards the frontal surface or anterior surface, okay, when the jaw moves, it is called as the protraction or protrusion or forward movement of the jaw. Okay, then second movement is just opposite of this. Okay, so it is called as the retraction movement. This movement it is, and this movement is the backward movement of the jaw. Retraction is the backward movement of the jaw, just opposite to the protrusion. Okay. Now the third movement which we will learn is the depression, and depression means where the jaw will go down. Okay, the lower jaw or mandible will go down, and this will lead to the opening of the mouth. Okay, so depression is the movement which leads to the opening of mouth, and then opposite of this will be the elevation of the lower jaw. That is, when mandible moves upward, it is the closure of the mouth. That means from open position to the closed position of the mouth. Okay, so these are two movements, depression and elevation. And lastly, we will run a movement what is called the chewing movement. Okay, masticatory movement. Okay, where the food is grind between the maxillary and the molar teeth. The molar teeth, not molar, the maxillary and mandibular teeth. Here the maxillary teeth, they remain stationary. Only it is the mandibular teeth which moves on to the maxillary tooth to form the grinding movements of the food. So these are the movement. Let us, before coming to the movement, just see this temporomandibular joint. Tympanic plate, external acoustic meatus, mastoid process, styloid process, and here is the root of the zygoma where the articular tubercle is present here. Okay, this is the mandibular fossa, a depression, the concavity downward, and this is the tubercle, articular tubercle, where the convexity is directed downward. So the surface of the temporal bone, squamous part of the temporal bone, okay, which is an articulating bone for temporomandibular joint. If you see it from anterior to posterior side, it is convex and concave, and if you see it from backward, it is concavo-convex surface. Okay, concavo-convex, and lined by this blue color structure indicates the articular cartilage, which is the fibrocartilage structure. Okay, fibrocartilage. The other bone which forms the temporomandibular joint is the condyle or the head of the mandible, which is also covered by here by the articular cartilage, again the fibrocartilaginous in nature. But speciality of this joint, which is sometimes classified as a complex joint, is that there is a presence of an intra-articular disc, okay, between the two articulating surface, squamous part of the temporal and the head of the mandible. Interpose is an intra-articular fibrocartilaginous disc whose shape is different in upper surface and different in the lower surface. See the upper surface of this intra-articular cartilaginous disc. Again, it is convex in its posterior half, but it is concave in the anterior half, and this convexity and concavity of the superior surface of this articular disc, they are facing upward, and this is just reciprocating, or just it is opposite to the surface, okay, of the squamous part of the temporal bone, that is mandibular fossa and articular surface. They are completely closely have the same opposite shape. Okay, so the cartilaginous disc will fit very well within the articular surface of this. Now in the lower part, the articular disc is only concave downward, okay, single, there is no double concave or convexity, and this is closely fitting to the convex head of the mandible, okay, convex. This red line indicates the synovial membrane, extra-articular synovial membrane. So this is a very special kind of joint where the joint cavity is divided in upper compartment and that of the lower compartment, and this itself indicates the movements which are taking place between the articular disc and to the mandibular fossa and articular tubercle. They will be different than the movements taking place between the undersurface of the articular disc and that of the head of the mandible. And then there will be some of the movements which will be taking place where head and the disc both will move towards, move forward or backward, okay, on the upper compartment, okay, both disc as well as the head, they will move simultaneously or together. Okay, with this brief introduction of the TM joint and its surfaces, let us come to the first movement, that is protraction or the forward movement of the joint. Okay, this is, in this movement what happens that the articular disc and head of the mandible, articular disc and the head of the mandible, they both glide forward. They both, as I said, okay, this lower compartment where the head is located and the disc itself, they both move or they glide forward, okay, they glide forward. And in the upper compartment, that means movement is taking place between this, the articular surface of mandibular fossa and the tubercle and the upper surface of the articular disc. So both of them, they are moving forward, okay, taking with them the lower compartment, okay, which is the deep to that of the articular disc, okay, articular disc. So in this way there will be a forward movement of the disc as well as the head, and because head on, and this movement, let me tell you, till I tell a specific one movement at one side, otherwise all this movement which I am describing, they are taking place simultaneously in both the joints, that is right and left temporomandibular joint. Now which is the muscle which is responsible for this movement, that is forward movement, which is pulling the disc as well as the head of the mandible forward, and the muscle is the lateral and medial pterygoid muscle of both the side acting together, both lateral and medial. And why this lateral and medial, they are pulling this the joint forward? The reason is that they are coming from the anterior side and inserting onto the posterior side, and when they will contract, naturally they will pull towards the origin side. So see in this diagram, this is the lateral pterygoid, upper head, lateral pterygoid, the lower head, and this is the masseter muscle here, okay, the lateral pterygoid taking origin from the lateral surface of the lateral pterygoid plate, and this is the body of the maxilla with the molar teeth, okay. So pterygomaxillary fissure, okay, is here, and deep 2 will be the fossa. This is the head of the mandible, the articular disc and the capsule. So this are attached, that means upper head and lower head both are attached, one to the capsule and articular disc simultaneously with the neck of the this mandible. So when this muscle will contract, see, so it will pull the head of the mandible and disc towards its origin side, means towards the lateral pterygoid plate, which is anteriorly located, because face is on this side and the occipital region is on this side. So this will pull it forward and the mandible will move forward. So this is the forward movement of the mandible, okay? Or protraction. And listen here, I mean say, see this diagram, and this is the diagram of the medial pterygoid, which is also responsible for the same movement. Now here the muscle is also taking origin from lateral pterygoid plate, but here it was from superficial surface, here it is taking origin from its deep surface. That means the origin site of the lateral pterygoid lower head and that of this this medial pterygoid muscle is the same. A small band of the superficial head is also there. This is the deep head, and this muscle is attached here onto the angle of the mandible, but onto the medial surface of the ramus of the mandible and just above the angle of. So this will also coming from anterior to posterior side, and its contraction will pull the mandible from both the side forward, because both the muscle medial and lateral pterygoid on right side and medial and lateral pterygoid on left side, they are acting simultaneously. Thus this both muscle medial and lateral pterygoid are responsible for protraction or the forward movement of the jaw. Let us come how this protracted or forward moved jaw is brought back to its normal anatomical position. And in this movement, the head of the mandible along with the articular disc will glide back. Here it was the gliding of the joint. Okay, that means disc along with the head was moving forward, okay, on the under surface of the upper compartment, articular surface of the upper compartment. Now this will be, the retraction will be just opposite of that. And how this retraction will be just opposite of that I will tell you. Here it will be brought it back by the retraction of the fibers of the temporalis muscle, okay. And which fibers of the temporalis? Let us see this. See this temporalis muscle here. These are the vertical fibers going to the anterior margin of the coronoid process, okay, and these are the upper fibers which are directly going. Then as you go backward in the temporal fossa, the fibers of temporalis, they become horizontal. So anterior fibers are vertical, but the posterior fibers, okay, they are horizontal, which are attached on the medial surface of this coronoid process. And these posterior fibers, which are horizontal fibers, which are coming from posterior or back side of the temporomandibular joint, okay, when they will contract, naturally they will pull the mandible along with the disc, okay. So this head of the mandible will glide backward to its normal position. So the retraction of the protruded mandible, that is the backward movement of the jaw, is because of the horizontal fibers, okay, of the temporalis muscle, okay. Probably the temporalis muscle is the only muscle in the body which can retract the mandible to its mandibular fossa. There is no other muscle which can retract it back. That means any other muscle is not coming from back side, okay, of the TM joint. They all are mostly coming from the anterior aspect. This is the horizontal fibers. They are the only fibers. I hope you have understood this protraction and the retraction movement, okay. Let us come to another movement, pair of movement, that is the depression, means opening of the mouth, and the elevation, okay. So let us come first to the depression of the mouth, that is the opening of the mouth. For this, let us see this diagram here where it is a closed mouth. Here the head of the mandible along with the intra-articular disc is inside the mandibular fossa, okay, inside the mandibular fossa. Now from this closed mouth we will open it, and in opening is means depression of the close mouth, I mean say opening of the mouth will takes place, okay, where the chin will go downward, okay, chin will go downward. First we will learn how the slight opening of the mouth will takes place, okay, as it is shown in this diagram. There is a slight opening because here the neck of the mandible is not running directly downward as it was in this case, it is slightly running backward, okay. So this will lead to the depression of the chin, okay, downward, and there will be slight opening of the mouth will be there. Let us see the description of this and muscle which are responsible for the slight opening or depression of the joint. In slight opening of mouth, the head of the mandible rotates. See this is the head of the mandible. It will rotate, okay, it will rotate forward. Head of the mandible will rotate forwards in lower compartment. Nothing is taking place. No movements are taking place in the case of the upper compartment of the joint, which was taking place in protraction and retraction because of the movement of the articular disc itself. Here only the movements are taking place only in the lower compartment where the head of the mandible is rotating like a hinge joint forward, okay, forward in the lower compartment, okay. That means this rotation is taking place on the under surface of the intra-articular disc, okay, intra-articular. How this movement is produced, okay, opening of the slight opening where jaw goes down. This is due to the contraction of the lateral pterygoid muscle of both the side, and this movement is also then assisted by the gravity. Let us understand how the lower lateral pterygoid muscle can cause the downward movement. It can cause the downward movement. See, the movements are taking place on both the side, and if you will see this lower head of the lateral pterygoid, here the fibers are taking origin from the lower level as compared to that of the head of the mandible, which is located at the upper level. And when the muscle will contract, then this head will rotate because it will be pulled down, okay, as well as rotated, okay. Muscle will be pulling it forward. So slight rotation because of its level of the fibers. They are at lower level, the head is at a higher level, so it will produce not only the forward movement but it will also produce a slight rotatory movement, gliding, I mean say this rotatory movement forward within the lower compartment, and thus the opening of the mouth will take place, a slight opening, okay, and then the gravity will come in action and then the mouth will open slightly. Now, what will happen in the wide opening of the mouth? When you want to take a big bite on the apple, you have to open your mouth or bring your mandible at much lower level, okay. Now, in this, after the slight movement which has taken place in the mandible, what will happen? It will be followed by the forward gliding of the disc and head of the mandible, as it has taken place in protraction or protrusion. The disc will be pulled after slight opening. The second step will be the disc is pulled forward, okay, and along with that of the head of the mandible, and the movement which I will just again explain you. First is number one step is the slight opening of the mouth with the two heads of lateral pterygoids. I mean to say right and left lateral pterygoid. And in the wide opening, the above hinge-like movement is followed by forward gliding. That means the head of the mandible will move forward, okay, gliding along with the disc, okay, along with as it has taken place, I said, in the protrusion or protraction movement we have just saw. And then this head, okay, and this disc both are pulled forward, and these are pulled till the head comes under this articular tubercle, which is a bump here. okay, which shows convexity downward. So the head will come under the articular tubercle. Now understand what will happen if the head comes under the articular tubercle. Previously it was just present inside the articular fossa. So its head was at a higher level. Once it will come under the articular tubercle, which is convex downward, the head will be pushed down. Head will be pushed down. That means it will not be at the same level as it was in a closed mouth or slight open mouth, but the head level will go down. That means whole of the mandible will go down because muscles are acting on both the side, and this will lead to the wide opening of the mouth. Okay, this will lead to, as you are taking a big bite on the apple, okay, then at that position the head of the mandible is under the articular, of course separated by the disc, but it is under the articular tubercle. Okay, let us see which are the muscles which are responsible for this opening of the mouth, slight opening and the wide opening. The lateral pterygoid is assisted by the anterior belly of the digastric in wide opening. After this slight opening by the lateral pterygoid, still the contraction of lateral pterygoid is continuing, and as the lateral pterygoid fibers are attached to the capsule and to the disc, okay, and to the neck, they will pull the disc forward as well as the head forward. So the gliding movement in upper compartment will takes place. And since the tubercle is above, say at a lower level, and head if comes under the tubercle, there will be another force which will push the mandible downward. Okay, so the chin will further go downward. Chin will go further downward. So this is possible because of the lateral pterygoid, and now the other muscles will come in its assistance, like the anterior belly of digastric, which is attached at the anterior near the symphysis manti, near lower border of the mandible, and it will pull the chin further downward. Okay, the mylohyoid muscle, which is attached on mylohyoid line on the body of the mandible, and the geniohyoid muscle, okay, geniohyoid muscle, which is attached to the genial tubercle, okay, lower genial tubercle on the posterior aspect of the chin. Okay, these all three muscles which are attached onto the mandible, they will pull the mandible downward along with the lateral pterygoid. So there will be the wide opening of the oral cavity. Okay, so this will lead to the wide opening of the oral. I hope you have understood the opening of or depression of the mandible. Let us come to the opposite movement. Okay, now we have to go back to the normal position after the wide opening. You have taken a big bite on the apple, and then your mandible should come to the original position for the chewing it. Okay, and this movement from the wide opening to the normal position is called as elevation. So we will learn now about the elevation or the closure of the mouth. Okay, so let us see the closure of the mouth, how it takes place, the closure of the mouth. Now the closure of the mouth, okay, it is the, movement where ultimately the articular disc, which was pulled forward because of the insertion of fibers on the disc of the lateral pterygoid as well as onto the neck in the this fovea of the neck. These fibers, okay, now will start ceasing its movement. That means movement is over of the lateral pterygoid, and articular disc and head of the mandible will now glide backward. Okay, it will glide backward in the upper compartment. Okay, the gliding is taking place between the upper surface of the disc and under surface of the mandibular fossa and the articular tubercle. Okay, so it will go backward in the upper compartment of the joint as it has come. So the same reverse procedure will follow. Okay, and this will be followed by the backward rotation of the head. The first step in slight opening of the mouth was the forward rotation of the neck within the lower compartment. Okay, and here second was then pulling of the disc and the head of the mandible under the articular tubercle. Same will be reversed. Now the First step in the closure or elevation will be that the disc and the head will slide backward, okay? And then once the head has come inside the articular fossa, or means say this is the mandibular fossa, then this will be further elevated because of the rotation. Then only the rotation in the head will take place. That means the head will be rotated backward, and this rotation will take place in the lower compartment. Okay, because the head has come to this position of the slide opening, and then the head in the slide opening was rotating forward. Here it will be reverse. Now it will rotate backwards, but this will takes place in the second or lower compartment. The pulling back of the neck and the head and the disc together was the first step, okay, and which was in the upper compartment. The gliding movement was in upper compartment. Now rotation movement is in the lower compartment. Now which muscles are responsible for this pulling it back, okay, and gliding? Medial and lateral masseter muscle, not medial and lateral, because it is pulling backward. There will be the masseter muscle, okay, and the superior and anterior fibers of temporalis and the medial pterygoid. Medial pterygoid, let us see, okay, how it will be pulled backward, okay, pulled. First is the masseter muscle. You are seeing the masseter muscle, and in this masseter muscle, the fibers which are oblique and vertical fibers, they will pull the mandible upward because it is wide open, okay, it is the complete opening of the mouth, and then it will be brought backward because of the contraction of both the heads, that is the deep and superficial head of the masseter muscle. I hope you have followed this, okay, the masseter muscle, right? So in elevation is helped to begin with the masseter muscle, and superior and anterior fibers of temporalis. See these superior fibers and these are anterior fibers, superior, and when the mouth is wide open, naturally the coronoid process has shifted forward here, and these fibers, when they will contract, anterior and superior fibers, they will bring the coronoid process upward, okay, they will bring the coronoid process upward. So this will be the second muscle which will be helping into the closure of the mouth, okay, elevation or closure of the mouth, okay. And then the medial pterygoid will also help, okay. How the medial pterygoid will bring the jaw back to the normal resting position. See the direction of fibers of the medial pterygoid muscle. These fibers are going from above downward. They are going from above downward. So when they will contract, the angle and the ramus of the mandible will be pulled up. This will be pulled up. So this will help in the closure. So the many muscle will help in closure. To begin with, it is the masseter muscle which will play an important role because it will pull the muscle upward. Then second is the vertical fibers of the temporalis, and it will pull the mandible upward. Similarly, to some extent the medial pterygoid, because it will also pull the mandible ramus and angle upward because of its direction. Above downward fibers are going. Okay, let us come to the last movement of the temporomandibular joint, and this is the chewing movement, means side to side movements. When we chew our food, our lower jaw moves first on one side and then it goes on to the back side, and in this way the grinding movements takes place. The food is broken into the smaller pieces between the maxillary and the mandibular teeth, okay, that is the chewing movement. Let us understand this chewing movement, how it will take place. Okay, here what will happen, here now just Okay, the movements are not taking place at both the joint right and left simultaneously. Here the movement will take place first at one joint, then it will be followed by the other joint. So alternate movements will take place on right and left temporomandibular joint, and in this way the chewing movement will take place. Okay, so now don't be under confusion. Till now we were just saying that these movements are taking place simultaneously onto the right and to the left joint itself. Now only on one joint this movement. So head along with the disc on one side. So on one side we are talking about. Now the head along with the disc on one side will glide forward. This will go forward. Okay, as we have seen previously, and this movement will take place in the upper compartment, because the lower compartment and the head, they are acting as a single unit. So both the disc and the head will move forward, okay, glide forward over upper articular surface. But as I said, that movement is taking place, say for example, only in the right joint. So the right head of the mandible and disc will move forward, but left is at rest, but not actually at rest. On the left temporomandibular joint, okay, or in opposite temporomandibular joint, there will take place a rotation, okay, and this rotation of the head which will take place, it will be in lateral direction on that side. Okay, and because of the rotation in the lateral direction in the opposite temporomandibular joint, okay, under the surface of the disc in the lower compartment, and rotation there in the opposite movement is taking place in the opposite compartment. Okay, and because of this vertical axis rotation in the opposite temporomandibular joint, what will happen? The chin will tilt to the opposite side. The chin will go to that of the opposite side. There will be first a forward movement because the head and the disc will be pulled forward, but then it will rotate to the chin will rotate to the opposite direction. Okay, this is the chewing movement. This is that of the chewing movement. And how this chewing movement will take place? Because of the medial and lateral pterygoid muscle of each side, they are acting alternatively. Okay, so see here, the first half of the movement is if taking place in right temporomandibular joint. The right temporomandibular joint, the head will move forward along with this, but at the same time in the left temporomandibular joint, there is a lateral rotation is taking place in the head along the vertical axis, and the head will rotate laterally in the opposite direction, in opposite joint. Okay, and because of this rotation, the chin will be protruded. Chin, half of the mandible is protruded, and chin will go on to the opposite side. Okay, why? Because the median and lateral pterygoid muscles of each side, now they are since acting alternatively. That means only if it is taking place in right joint, only the median and lateral pterygoid muscle of the right side will contract. It is not the left side will contract. Whatsoever rotation is taking place in the opposite temporomandibular joint, it is a passive movement. Probably it is a passive movement by which the tilting of the jaw is taking place to the opposite side. And let us see why the median and lateral pterygoid, when they act together on one side only, they will lead to the tilting. Okay, for that you have to understand with the help of this diagram. This is, say for example, outline of the mandible, and say for example, this is the head of the mandible, okay, in the temporomandibular joint. This is the right side and this is the left side. As I said that in the chewing movement or masticatory movement, the muscle median and lateral pterygoid of one side will contract only. First see the lateral pterygoid. This is suppose the lateral pterygoid muscle is here, which is gaining attachment onto the fovea or onto the articular disc. Okay, now this lateral pterygoid muscle is taking origin, say far it is the lower head only of the lateral, it is taking origin from the lateral surface of the lateral pterygoid. This is the lateral pterygoid plate and this is the medial pterygoid plate. On this side again this is the medial pterygoid plate and this is, see this pterygoid plates that they are placed, okay, anteriorly, number one, and number two, they are also placed medially. Suppose this is the median plane, okay, so the lateral pterygoid plate and medial pterygoid plates, they are close to the median plane as compared to the head of the mandible. And when the lateral pterygoid muscle which is attached to the neck of the mandible will contract, what it is going to do? It is going to bring this head of the mandible forward, because of which the contraction because of which the gliding movement along with the disc will take place, and then since it is coming from medial to lateral side, it will try to bring the neck of the mandible and head of the mandible towards the pterygoid plate forwards and medially. In doing so, there will be a passive rotation in the opposite TM joint along this vertical movement which is passing up and down. So this will rotate towards the lateral side. Because of the rotation towards the lateral side, because of the contraction of the medial and lateral pterygoid plates on right side, what will happen? The jaw will also move to the opposite side where the contraction are taking place, and this is because the insertion, the origin of lateral and medial pterygoid, and medial pterygoid also take origin from the medial surface of the lateral pterygoid plate, but its direction is downward, going to the medial surface of the ramus, much downward. Okay, and that is the reason why the tilting will take place towards the medial side. So this is the main action on tilting is because of the lateral pterygoid muscle, but the forward slipping of the head and the disc in the initial stage are both because of the lateral and that of the medial pterygoid. It will pull forward, okay, it will pull. And since in the medial pterygoid also it is taking origin from medial surface of lateral pterygoid, and insertion is also much more laterally to the median plane onto the ramus of the mandible and above the angle. This will also help in the tilting of the jaw to that of the opposite side, I hope you have followed the chewing movement. This will take place on one side, then the jaw will come to the normal resting position because of the retraction of the muscle, okay, posterior belly of the the horizontal fibers of temporalis, and then what will happen that after it has come to the resting position, now the muscle of the left side will contract, medial and lateral. Thus the jaw will be tilted towards the right side, and in this way alternatively they will keep on going and just the chewing movement will take place. Thank you very much for watching this video. Unexpectedly it became a long video because of the explanation. I'm sorry for that. Okay, thank you.